I just want to begin with a little disclaimer. I know my title says that we are going to overcome the fear of hypoglycemia, but it's a bit hard to do in half an hour. My aim is to show you what has been proven in scientific articles. So you will find at the bottom of my slides, I often cite studies so that you can refer to them if you want. So yeah, now we can begin. So we'll begin with a little bit of history. So all of you know that type 1 diabetes is an autoimmune disease that results in the destruction of the cells that are responsible of the production of insulin, which is the molecule that helps the blood glucose to low down. And probably most of you also know that insulin was isolated a little more than 100 years ago in Canada. Um, and thanks to that, insulin was used as a treatment, and so the use of insulin completely transformed type 1 diabetes and its prognosis. The problem is that, of course, when insulin was used, acute high blood glucose became manageable, and life with type 1 diabetes became possible for children and teenagers with type 1 diabetes. But insulin also came with its downsides, and namely the discovery of hypoglycemia. So, of course, insulin have become easier to use and more adaptable to the everyday life. But as of today, hypoglycemia is still a very common problem and a very impactful problem. So I know most of you have already experienced it, but I'm just going to sum up the main symptoms so that everyone is on the same page. So usually if your blood glucose goes lower than 3.8 millimole or something like that, you will begin to feel like your heart pumping very fast, or your hands shaking, or sweats and things like that. So all of these symptoms are called adrenergic signs. They show that your body is feeling a stress. And then if your blood glucose continues to go down and goes below 3 millimole, you can have what are called the neuroglycopenic signs, which means that your brain doesn't receive its main fuel, which is glucose. So that can manifest by difficulty concentrating, or having a blurry vision, or tingling in your fingers, or a very sudden hunger. And of course, all of these signs will lead you to take glucose. And everything is supposed to go back to normal in about 15 minutes. So for people who don't have type 1 diabetes or don't take insulin, this seems to be quite a simple problem. You have symptoms, you take glucose, and it's over. But you know that it's not that simple. The first thing is that all of these symptoms are very unpleasant, and they can happen at any time, especially when you're doing something important. Another problem is that, as was reported in the study that is cited below, at the bottom of my slide, having a hypoglycemia can be very frustrating, because even if you've done everything like you should have done, you take exactly the right dosage of insulin, you take exactly what you supposed you were going to eat, you can still have hypoglycemia. And that's very frustrating. And the people around you not realizing it can be very frustrating too. And another thing is that sometimes things don't go according to plan. So it may be because you're very busy and you don't pay attention, or you've forgotten your glucose at home this morning, or you can be in the 20% of people with type 1 diabetes that have impaired hypoglycemia awareness. So that means that you don't feel the symptoms anymore. So all of these problems can lead to severe hypoglycemia, which is when you need the assistance of someone else to take your glucose. And so the unpleasantness of the symptoms and the risk of having a severe hypoglycemia can all lead to the fear of hypoglycemia, which is a normal reaction to all of this. So before going into detail about the fear of hypoglycemia, why it can be really intense and like that, I would like to begin with how do we assess the presence and the intensity of the fear of hypoglycemia? So that's important for research to know exactly what's happening, and in the everyday life for healthcare professionals to help you to see if something can help, or to see if something really makes it flare up. So there are lots of different scores. The one that is mostly used is called HFS2, but there are also ones for parents of children with type 1 or shorter ones so that they are easier to use in the everyday life. But all of them have kind of the same questions. So for example, I will show you here the questions that are found in the HFS2. You've already read them because they are in the better questionnaires. And so the idea is that we ask, is it never or is it very often that you experience all of that? And so if you say never, it's a score of 0. If you say all the time, it's a score of 4. And then we add all the scores and we have a global score. And um, the idea is that we have questions about the behaviors. So, do you often eat large snacks to avoid hypoglycemia? Do you limit your physical activity? Do you always try to keep your blood sugar a little higher? And then there are also questions about worry. So that's the real anxiety part, the real fear part. And so these ones are you often afraid that you are not going to realize that you have low blood sugar? Or do you often fear you are going to pass out in public or during your sleep or while you're driving? So that's how we can assess what's going on. So now the question is, why do some people develop a very intense fear of hypoglycemia? Are there certain circumstances or are there some types of people who develop them more? So first thing is there are science reasons to develop them. So in mice, researchers have found out that the brain cells that are responsible to the reaction to hypoglycemia are the same that give you a response to fear. So in other words, when a mouse has a hypoglycemia, it's going to feel fear. Another experiment was performed on rats. So researchers induced repeated moderate hypoglycemia during the childhood of the rats, and then they stopped doing that, and they observed what happened. And they realized that the rats that had lived with this hypoglycemia had a harder time separating from their mother. They were easily startled by noise. They showed more signs of fright. They had higher levels of stress hormones, and they did less social play. So you could say that just having these moderate hypoglycemia during their childhood induced something quite close to a post-traumatic stress disorder. So now let's go back to humans. So for humans, there are different circumstances that can induce an intense fear of hypoglycemia. First, it's the time of diagnosis of diabetes. If the healthcare professionals draw a very threatening picture of life with diabetes, or conversely, if they completely downplay its seriousness and complexity, it can be very weird once you really live with it, and it can intensify your fear of hypoglycemia. And then during the follow-up, uh, many people with type 1 diabetes say that they lack practical support and they don't discuss enough about how they can manage their life with diabetes at work or with physical activity, or just how do they feel in the everyday life. And then people around you can also influence you. So one of the study coming from the Better Registry showed that people who perceived higher levels of stigma, so feeling judged, also had higher levels of fear. But honestly, the main reason for developing a very intense fear of hypoglycemia is having a history of severe hypoglycemia. So when you've had in the past a severe hypoglycemia, it's really, really frightful. Yeah, you can be really afraid after that. And also for parents, when their children have a very high variability during the night, so they don't know if it's going to be high or to be low, it can also be very frightening. So there are also different people who are more at risk. Lots of studies show that women are more afraid of hypoglycemia for lots of different reasons. Um, Age and duration of diabetes are very debated. Some studies show that people with a very long duration of diabetes have less fear, and others show that they have more fear. So it's not very clear. But what has been shown is that people living in Western Europe or in Canada have less fear than from the rest of the world. And then something also important is that having a pre-existing emotional state. So people with anxiety traits or with depression before diabetes are more at risk of having high fear of hypoglycemia. So, okay, we now know who is more at risk of developing high intensity fear of hypoglycemia, but there is a very important question. Is it really a problem? Because we've just said that it's a normal reaction to a very stressful event. So maybe it can help reacting properly and be careful and just avoid a very big hypoglycemia. So why is it really a problem? So if you're a public health instance, a ministry or a state, you want to know if there's an impact on workability and money. So one study showed that it can, but okay. For a healthcare professional, the question will be, does it have an impact on glycemic balance? So a first study in the 90s happened just after the results from the studies that showed that when you keep your blood glucose lower, you're less at risk of developing complications on the long term. So one of them was the DCCT study, a very famous study. And there was people who had high fear of hypo were asked if they were more afraid of the idea of having new recommendations with higher intensity insulin treatment. And they were more afraid, and they said that they were less likely to follow them and to try to keep their blood glucose lower. However, things have evolved now. There are new technologies and everything. So is it still true today? So you will see that some studies that, yes, it's more difficult to manage your diabetes when you have high fear of hypo, and others says that it's not. So some studies show that people who have higher fear of hypo take more bedtime snack, they take more daily calories intake. They can sometimes avoid their boluses mostly at night or in the evening to avoid having hypoglycemia during their sleep. They can also avoid alcohol, which is not a bad thing, and sometimes they can delay their boluses. However, other studies that show that those delayed boluses are mostly seen in people with type 2 diabetes treated with insulin and not in people with type 1. And also, other studies show that fear of hypoglycemia is not associated with glycemic variability when you check on the continuous glucose monitoring. And another study even showed that children and teenagers who had higher fear of hypo uh, were, in fact, had even blood glucose levels closer to targets. So it's not that clear. Another question that comes back often is fear of hypo associated with more difficulty to do physical activity? So in the Better Registry, there is a study going on now that shows that adults living with T1D are less active than the general population, do less physical activity. And fear of hypo is often seen as the first perceived barrier to physical activity. However, it's not that simple because, for example, in children, it has been shown that children who do more physical activity also have higher fear of hypo, probably because they realize that when they do more physical activity, they also have more hypoglycemias. And it does not prevent them from doing it. So it's a very complex subject, and we're not sure that fear of hypo completely stops you from doing physical activity. So let's say that physical health is not that uh, there's not that much a problem with fear of hypo. However, mental health is another question. So many studies show that people who have high fear of hypo have more depression, more fatigue, anxiety disorders, diabetes-associated distress. They are less socially active. They can have fear of having a hypoglycemia during sexual intercourse. Acceptation of diabetes can be more difficult, and they can have more sleep disorders. So you have to remember that people who had more anxiety traits and had more depression also were more at risk of developing fear of hypo. So it's a complex subject, but still we are under the impression that fear of hypoglycemia has an impact on mental health. And it has also been shown that quality of life is poorer in people with high fear of hypo. And that's true for men, for women, for adults, for teenagers. So that's the important question. And that's why we have to do something and help people with high fear of hypo. So it's also true for parents who have children with type 1 diabetes. So same thing, the impact on the glucose management is very debated. However, the mental health is impacted. So Parents have more diabetes-associated distress, depression, anxiety, parenting stress, burnout, and mostly sleep disorders. They can have more conflicts with their children, especially around meal times. And there are some specificities. Mothers have more fear than fathers, and sadly, mostly because they are more they are the ones who mostly take care of their children for type 1 for the diabetes. Something quite reassuring is that fear decreases when children get older. So if their parents, of course, if their parents trust their ability to manage diabetes, so things get better. And another quite reassuring thing is that the parents' fear is higher than the children's fear. So if you're a parent with a type 1 with a child with type 1, you can safely think that he's less afraid than you are. And then for partners, same thing. There is more diabetes associated distress, more sleep disorders. There can be problems for the couple relationships. And partners who do not live with diabetes are more afraid than those who do. And then there are also other people, so teachers. One study showed that when teachers are trained to manage hypoglycemia, the inclusivity for the children with type 1 diabetes is better. We all know that it's difficult to implement in the real life, but it's very important to know. And there is also the question of the healthcare professionals. And that's quite a sad thing, but studies from the 2020s still show that blood glucose is still inadequate in surgery or in intensive care departments because healthcare professionals are afraid of inducing hypoglycemia. And another study also showed that physicians still do not talk enough about hypoglycemia and their consequences in everyday life. So that are all of those questions are things that we have to work on, and we know we do have to work on that. But okay, we've talked about depressing things, and now we can go to another part that is more uplifting. So what can we do? And yes, things can get better. So the story continues. Lots of new technologies, you know that. But before continuing, yeah, I just want to talk to you about something called the Horton effect. So the idea is that when you take part in a study, it can have an effect on its own. So, for example, if you want to know if using CGM can help with fear of diabetes, if people in the study are called very often and have more consultations than usually, it can by itself just decrease the fear of hypo. And in fact, it's not the effect of the CGM. So it's something that you have to keep in mind when I show you the results there. So we said that in the 19th, the idea was to intensify insulin to avoid complications on the long term. And then new insulins arrived, so Humalog, Admelog, Glargine, Lantus, or Degludec, or Tresiba. They all decreased a little bit the risk of hypoglycemia. So they also decreased a little bit the fear of hypoglycemia. But it was by a very little amount. So it's not that important. And then continuous glucose monitoring arrived. So it's like the Freestyle Libre or Dexcoms, you know. So they helped with glycemic balance and they improved sleep for almost everyone. But the levels of fear decreased mostly in people with impaired hypoglycemia awareness and mostly on the behavior part of the questions and not really on the worry part. So people did not maybe reacted a little better to hypoglycemia, but they were still very anxious. And in fact, sometimes the anxiety even increased because you were suddenly able to see that you had lots of hypoglycemias. But what really helped was the alarms. So also on the new versions of Freestyle or of Dexcoms, and it really decreased the number of severe hypoglycemias, and it also really decreased the fear of hypoglycemia, mostly for people who had blood glucose in very low levels or quite high. And then the sensor augmented pumps were also implemented, and of course the automated insulin delivery systems or closed loops. So the first generation, the 640, had high rates of discontinuation because of alarms, of calibration. So it was not that efficient. But then the new generations, the Medtronic 780 or the Control IQ, were more efficient because they decreased the risk of severe hypoglycemia and they were quite effective on the fear of hypoglycemia in adults and in parents of children living with type 1. But in teenagers, it's really less clear. And then in 2020, intranasal glucagon or Baqsimi was also implemented. It's easier to learn than the ones with the injections, but it did not decrease that much the fear levels. So apart from technologies, what can we do really? What action can we take? So there are lots of different programs. Some of them were developed for people with impaired hypoglycemia awareness, and some of them were really developed for the fear of hypoglycemia. So Red Chip, for example, is for parents with high fear of hypo. Hypocompass is one for people with impaired hypoglycemia awareness. And before saying how it works, do we know if they work? And yes, they do. Hypocompass can decrease fear of hypo by 18 points. It's really high. And apart from that, it can also increase awareness of hypoglycemia, decrease the frequency of severe hypoglycemias, and sometimes help with general glycemic balance. So what are these programs made of? So the idea is that it's usually by group sessions with 4 to 20 people. It can be on-site or online, both work. And short sessions, like a half an hour every week for 4 to 12 weeks, are more efficient than very intensive programs over a weekend or boot camps. And a result that I like is that participants who try to help others with their respective problems have more results in the end. So it helps to be nice. um, So, of course, you cannot take part on one of these programs right now, and sometimes it's hard to find one. So, I just wanted to tell you here what are the main ideas of these programs. They have been summed up in an article which I cite on the bottom of my slide here. So, we can categorize people in two groups. The first one is people who are at risk of severe hypoglycemia. So you are in this group if you've had a severe hypoglycemia in, say, the last 2 or 3 years, or if you have very common hypoglycemias, or if you don't really feel your symptoms of hypoglycemia. So you're in that group. In that case, you have to follow the advice, be safe. And what is this advice made of? So you have to ask yourself questions. Why am I at risk of severe or of hypoglycemia? Do I take lots of medication that can interfere with blood glucose management? Do I take too much insulin? And in that case, which one? Is it the bolus? Is it the basal? And how can I change that? And the idea is to discuss with your healthcare professional to exactly find what is right for you. And then when am I at risk? So is it a certain time of day, or is it after meals, after physical activity, during your holidays, or during your work days, or during your at some point of your menstrual cycle? There are lots of different times when you can be at risk. And if you identify them, you can be extra careful at these times. Then you can use technologies. So, of course, closed loops, alarms, and things like that can really be of help. And one of the very important things is to be prepared to treat your hypos. So have a very precise glucose intake plan. What are you going to take? In how much? Always have it on you and always have it everywhere where you need it. The other question is, do you have glucagon? Where and who knows how to use it? So I am currently doing a study on the Better Registry about people having with impaired awareness of hypoglycemia, and we've seen that 40% of people do not have anyone in their entourage who knows how to use glucagon. So it's something that we can work on too. And then you have to establish a no delay glucose value. So this thing is, you have to say that, for example, each time that you have a blood glucose lower than 3.9 millimole, you have to take glucose. Even if you're doing something, even if you're very busy, you have to take glucose at this value. And then for people with impaired hypoglycemia awareness, the idea is to avoid any hypoglycemia for a short period of time. So like for 2 or 3 weeks, you have to have zero hypo. So of course, for that, you sometimes have to set a higher target and accept to be a little too high for a while. But that will help your body to listen to the signs again, and you will be able to identify and to react to subtle cues of hypoglycemia. And all of the idea of this be safe advice is to take charge again, be able to be the one who decides what to do when hypoglycemia happen. And that can help decrease the level of fear of hypoglycemia. And then for people who are not at risk of severe hypoglycemia. So you're in this group if you didn't have any severe hypoglycemia in the 2 or 3 last years. You don't have that common hypoglycemia, maybe 2 or 3 weeks max, and you feel your symptoms well. So in that case, you have to follow the advice, feel safe. So how do you feel safe? You can use technologies, alarms, having someone that receives your alert, your alarms and things like that. It can be gradual to avoid majoring your stress if you see it, if you see you're in hypo all the time, for example. You can learn to discriminate your symptoms because symptoms of hypoglycemia or of anxiety can be very, very close. Having shaking hands or things like that, it's very close. So the idea is to learn relaxation techniques and use them when you feel the first symptoms and see if all of the symptoms disappear because they are not supposed to disappear if it's a real hypoglycemia. Of course, once again, it's for people who are not at risk of severe hypoglycemia. You should not do that if you're at risk. But in the case when you're in for those people, you can. The idea is to break the hypo-anxiety cycle. So I might have a hypo. It makes me anxious, so I have more symptoms and. So yeah, the idea is really to discriminate and find out what is really your symptoms of hypoglycemia. Then you can evaluate hypoglycemia treatment. So how long does it take to increase my blood glucose by 3 millimole? Which type of glucose helped the most? And when does it help the most? Because sometimes it does not do the same effect in the morning or in the evening. Which amount should I use? Because sometimes, when you're in hypo, you want your blood glucose to go up very fast. So you take a lot and a lot of glucose. And in fact, it does not make it go higher quicker. So yeah, lots of things like that to test and to find out for yourself. And then you can also find strategies to deal with the waiting period between the time you take your glucose and the time your blood glucose is not in hypo anymore. And sometimes this period can be very stressful. So you can find things that will help you, something to occupy your brain during this period. And then you can do something called graduated exposure with personalized goals. So for example, if you're afraid of doing physical activity, you can do it very gradually. So first you will take someone with you and walk for 10 minutes. And then you will walk with someone for 20 minutes. And then you can try to run for a minute with someone. And then you can try to run by yourself. And it has to be very gradual and it will help decrease gradually your fear of hypo. So apart from these programs, there are some little studies that could give ideas for the future. One study was performed in people with type 2 diabetes and used EMDR. So, it's this technique where you have to move your eyes, and it is effective for people with post-traumatic stress syndrome. And it really helped for people with type 2 diabetes with high fear of hypoglycemias. But it was just one study. Another idea is that we can try to do things for physicians and not for people living with type 1, and it can help. Physicians can decrease their own fear too and help and be of more help afterwards. And last but not least, there is the support platform. So for those of you who don't know it, it's a learning platform related to the Better Registry. You can take part in it, and it allows you to take little auto-training courses. And a study that was published in 2023 showed that people who took the courses about fear of hypo decreased their fear by 10 points at 12 months, which is quite good. So you see that you have tools associated with the Better Registry to help. So to sum everything up, fear of hypoglycemia is a normal reaction to very scary events. So it's normal to have fear of hypoglycemia. But when it becomes overwhelming, it can have a really important impact on quality of life. And newer technologies, especially CGM with alarms and recent closed loops, really do help, but not enough. They do not make it disappear. So it's still a burden, and there are other things to do. But in all situations, you can have a risk of severe hypo or not, have an impaired hypoglycemia awareness or not. Solutions exist to mitigate this fear. So yeah, you do not hesitate to talk about it with your healthcare professionals because you can have help. Thanks a lot.
I'm coming. Okay, I wasn't able to turn on my camera, sorry. So thank you, Lau, for this great presentation. It had a lot of concrete, applicable advice. I think that can be very useful for people listening to us. There are some questions that are coming up in the chat if or in the Q&A functionality of Zoom. So if any of you have questions, feel free to write them in. Um, I think a lot of content you were talking about is found on the support platform as well. So my colleague Sarah put the link of the support platform in the chat. Everyone is welcome. Any adult or healthcare provider in Canada, obviously adults with type 1 diabetes, are welcome to join and go create accounts. We have stuff on how to distinguish a hypo from a panic attack, how to what to do if you you feel like eating everything when you're in hypo. So we try to put in really applicable advice in there. So someone wrote, I think it's more of a testimony than a question, but if you're okay with it, I would read it through and we can discuss or see if you have any advice for this person. So I've tried both the Freestyle and the Dexcom for several months. I'm allergic to the glue and it caused very distinct welts, exactly the same shape as the devices. Also, the readings were not very accurate. The alarm would go off, and so I'd eat, but my A1C went up during that time. I'd sure like to get a working CGM because I don't allow myself to sleep more than 2 to 3 hours at a time. A bit of, I think a bit of a nuisance might be an understatement.
Mm.
So this person is hasn't had success with the CGM and
So
is not sleeping through the night. So
so the skin part, there are lots of different little tips that can help. So that you can really discuss with your healthcare professionals because there are you can put little sprays on your skin before or some bandages and things like that can help. So this part can be there are solutions. The accuracy part can be true for some people. Sometimes when you take medications, it can interfere. So you can check that, and then yeah, you can try to see if it's accurate when you compare with your capillary tests. And sometimes if you see that it's always like higher than your capillary, you can try to compute what is the real thing. But some it can be true for some people. But usually, when you try different devices, one of them is supposed to be quite good.
Mhm. Especially, I don't know when this person tried the CGMs, but the mo more recent devices also they're constantly improving the and precise the preciseness. So I hope
Yeah.
this helps. Um, Another question. So can the length of time to treat a low blood sugar change over time? I feel like it takes not a lot longer for my blood glucose to rise after a low, after 52 years of type 1 diabetes.
Um, So yeah, I think so. I mean, I have no proof from scientific literature, but yes, because we know that especially when you have neuropathy, so complications on your nerves, which happen when you have had diabetes for a long time, your body does not usually react as well as it did before. So it is possible that it does not react exactly as it did before.
Mhm.
But yeah, I think you still can find ways to make it work. So maybe change a little bit the type of glucose you take or the amount or things like. It's exactly what I said. You can do tests on what works for you.
Mhm.
Mm.
So in the clinical practice guidelines, we talk about taking 15 grams and waiting 15 minutes for the blood sugar to rise. But we now know that this is to be individualized because not all have the same insulin on board, not all have the same, so not the same amount of carbs won't have the same effect on everybody. So it's really, I think you're right to find like something that works for you. Um, and so my colleague also put in the chat, so to come back to our first question, we did put together a list of different products that can be applied when you do have allergic reactions. And so the PDF of it is now in the chat, hoping it helps. I think we've answered all the questions that came up for now. Um, I just want to thank you for your time and your presentation. I think this was very a good so good practical tricks and also having it in context of the research and what was happening. So where does the hypo come from? So the discovery, starting with the discovery of insulin, which is very obviously life-saving, but it does come with its disagreements. So thank you for putting that in. Yes, a long way, Miss. The woman, sorry, the woman commented on our answers. According to the time to increase blood sugar after a hypo, it says a long waiting period is very distressing. I can imagine. Um, so thank you all. The webinar will be available as a replay later today. We will share the link and the password to access it. And our next webinar will be in July. Stay tuned to know what the subject will be. Thank you again, Laure. Have a great day, everyone.